Okay, hi, my name is Michelle Chan, and I'm going to be doing the persuasive speech. And these are my audience members. This is Allison, Sergio, and David. So today, the speech is going to be about pelvic floor dysfunction. This is an overview of my presentation. There is going to be an introduction, and purpose is to educate the audience about the prevalence of pelvic floor dysfunction and to urge more research and attention to the topic. And then I'm going to go through about what is pelvic floor dysfunction and how does it affect people. And then go through what changes during pregnancy and labor that will maybe be linked to pelvic floor dysfunction later in life. And then what are the current treatment and prevention techniques available in conclusion. So introduction. In the United States, 3.8 to 24% of women ages 15 to 73 years old report some kind of pelvic pain. And pelvic floor dysfunction is a disorder in which 10% of the women in the U.S. will require surgery some point in their lives for it. So as you can see, it's really prevalent in the U.S. And so far, pregnancy and labor are the biggest factors known. There are other predisposing labors like genetic dispositions, obesity, lifestyle stuff. So pregnancy and labor are the biggest risk factors. So what is pelvic floor dysfunction and how does it affect people? So the pelvic floor, as we all know, is made up of the bony pelvis and the muscles, fascia, and ligaments, and the organs inside the pelvic floor. And pelvic floor dysfunction is basically an umbrella term for disorders having to do with the pelvic floor. So for example, urinary incontinence, fecal incontinence, and pelvic organ prolapse are some of the things under the pelvic floor dysfunction umbrella. And it is really linked with traumatic injury during delivery. And here I have a lovely diagram of the pelvic floor. So what changes happen during pregnancy and delivery? So as we all know, during pregnancy and delivery, a lot of mechanical changes occur, and deformation occurs in the birth canal not seen in any other part of the body. The nerves, the levator ani muscles, the uterosacral ligaments, these all get lengthened and stretched and weakened during pregnancy and are even more prone to damage during labor, especially the second half of the delivery. Something else that can happen is diastasis recti, which is a separation of the right and left abdominal muscles, and this causes lower recruitment of the muscle fibers, which is really bad. And it could also be linked to weak pelvic floor, which is not good. Another thing is increased laxity in joints. So the SI joint as well as the pubis symphysis joint will increase in laxity during pregnancy, and it makes it more unstable. And the pelvic organs will naturally descend as the baby increases in weight. So what are the current treatments and prevention techniques? So right now, currently we have a lot of postpartum treatment, but not really many prevention treatments. So that's what I found during my research. So every year, 300,000 to 400,000 American women receive surgery due to pelvic floor function, and about 30% of these are reoperations. So that means the operation techniques that we have right now need to be improved. Most of our treatment are focused post-injury, not focused on prevention, and the prevention is mostly general lifestyle interventions, but we need more specifics. So the treatment available is surgery and pelvic floor training with a physical therapist or some kind of medical professional. So summary and conclusion, pelvic floor dysfunction symptoms are bad enough for 10% of the women in the U.S. to opt for corrective surgery sometime in their lives, and it demands more attention from the medical research community. There's not a lot of research on preventative stuff, such as what are the specific mechanisms of injury during labor, and what are the predisposing factors that will put women at risk for more traumatic injury during delivery. So although many women are affected by these disorders, the attention received still needs improvement. We need more involvement of doctors actually conducting these deliveries, more awareness about episodic things and stuff like that, as well as more knowledge in the specific injuries, how to prevent them, and our current treatments. So more work desperately needs to be done, and more education on this disorder. So thank you guys for listening.